Hello, everybody, and welcome to Functional Medicine with me, Dr. Howard Robbins. As you know, our show is dedicated to safe and healthy ways of treating diseases and conditions that will either kill you or diseases and conditions that will make you wish you were dead. Today, we're going to talk about the former, the ones that can kill you, hepatitis B and hepatitis C. Hepatitis B and C are viruses. There's actually a lot of different hepatitis viruses, D, E, F, G, and H, and there's probably more that are going to come out. Almost of the opinion that they might even be the same virus that's mutated over the years into different forms. So they call it different, they give it different letter names. Generally speaking, you all know about hepatitis B and C because there's a vaccine they want everybody to get for hepatitis B. And I'm an anti-vaccine doctor. I always admit it. So I'm not going to recommend that you do it. I'm not telling you what to do. I'm nobody's boss. I barely have control over me, let alone anybody else. But let's talk about what you can do naturally and safely to eliminate these infections. If you have it, if you have these infections, you're not just listening to the show to learn what are the symptoms of it. I used to do shows that went into the details of the symptoms and issues. We're not here to diagnose. I'm here to tell you how can you actually treat it in a safe and effective way. And first of all, you want to make sure that you avoid doing things that are going to make it worse, such as drinking alcohol and taking all sorts of recreational drugs. You just can't keep living an unhealthy lifestyle and get rid of these horrible life-taking infections. Because what they do is they seriously damage your liver. And with that damage to the liver, you can get cirrhosis of the liver where it stops working, and ultimately you die. And they will not give you a liver transplant if you're lucky enough to get even on a transplant list, because the virus is in your body, it's in your blood, it's in other cells, and it can reinfect a new liver. So you've got to get rid of the one you've got. So living a healthy lifestyle and avoiding the use of alcohol and caffeinated beverages, refined sugar, refined foods, anything that contains herbicides, fungicides, pesticides. You want to avoid anything that contains that. So sticking to an organic food diet becomes very valuable and important. You also want to avoid foods that have artificial colors, flavors, and preservatives. Now, I don't care what you do. I'm not your boss. But if you don't take that advice to start with, then everything else you're going to do is going to have less of an effect. Now, the most important way to get rid of it, I'm going to talk about last. But in the meantime, let's talk about stuff that you can do at home. First of all, you want to supplement large amounts of antioxidants. Vitamin C should be taken 5 or 6 times a day, 1, 2, 3,000 milligrams if you can tolerate that much, every 2 hours. Yes, not just once or twice in a day, 1,000,000 milligrams, but every 2 hours. Your body will use up what it needs and then eliminate the waste. And please don't buy crappy, cheap vitamin C. Because it doesn't absorb well, so it's not bioabsorbable, it's not bioutilizable, and then it's not necessarily bioavailable. So it pays to buy from some of the big name companies that specialize in vitamin C. There's liposomal versions in capsules, so it's sort of a gel that really works well. But you can buy powdered vitamin C's that are buffered if it irritates your stomach. But you want to take vitamin C every 2 hours while you're awake. Next is you got to be well hydrated. It is so important that you be well hydrated. I can't overemphasize that. It's vital. It's vital to you staying well. You also need to have a healthy gut. And that's why we always recommend Doctor's Biome Probiotic, GutHealth, Doctor's Biome GutHealth probiotic beverage, because it comes in a 100% organic mint, kale, lettuce, cucumber, celery, apple, lemon juice. So it's delicious, and it has living bacteria in it. They actually can survive the stomach acids because they're next generation, and they're already living. They're not in a capsule, powder, or tablet form, which may or may not come out of suspended animation, being asleep, so to speak. And those that did survive freeze drying may get destroyed in the gut. Doctor's Biome is created to survive the gut acids. It's actually, these bacteria are happy living in it. And then they get immediately transferred, because you always take it on an empty stomach, into the gut. And then they're called smart probiotics because they stick to the gut wall. The gut bacteria, it's called the gut-liver axis. The gut bacteria communicate with the liver. Plus, if you're going to take all these supplements I'm going to recommend and you don't have a healthy gut, you will not absorb them into your blood, even though you're spending fortunes on them every day and every month. People don't get that or understand that either. And unfortunately, they're wasting their money. It's going in one hole and out the other end. And if you want these supplements we're going to recommend to work, you got to have a healthy gut. Now, many studies have shown that the things I'm going to be recommending are valuable. For example, vitamin E in the mixed tocopherols. You should be taking 800 milligrams of vitamin E every day. Vitamin C, I already mentioned. Quercetin is also a very important supplement to take. There's varying amounts that should be given to different people. Start with a low dosage and add on an extra tablet or an extra capsule until you're taking 2, 3, or 4 of each, thing each day, seeing how it may have affected you in a positive way. Remember, you won't digest and absorb all of it. You need B complex vitamins, especially B12. Now, for B12, you got to get shots from a doctor who uses methylcobalamin or hydroxycobalamin. It's very hard to get B12 nutritionally because most of it gets destroyed in the stomach. And cheap B12, cyanocobalamin, doesn't absorb virtually at all. When you get a shot of methyl or hydroxycobalamin, your urine should turn pink within 1 urination or 2 urination cycles, within an hour or 2. Otherwise, you didn't absorb it. And you may want to get a larger dose than 1,000 micrograms. 2, 3, 4,000 micro. It's safe. You can't OD on B12. Selenium, 200 to 400 micrograms a day of selenium is important. Zinc, which is a trace mineral, you may want to take at least 50 milligrams of zinc a day. 5 milligrams of folic acid a day is beneficial. If you have a doctor that can do intravenous glutathione like we do in Manhattan, our Manhattan office, that's a wonderful supplement to add on because it helps in the killing and destruction of viruses. And you can make a natural glutathione if you use a combination of vitamin C and 600 milligrams of NAC, N-acetylcysteine, and alpha-lipoic acid, about 500 to 1,000 milligrams of that. And you do that twice a day. And along with the vitamin C, you can create your own natural glutathione in larger amounts. Taking oral glutathione is virtually completely destroyed in the stomach. So once again, it's a complete waste of money to buy various forms of glut. S-adenosylmethionine, SAMe, is vital for liver function and regeneration. Polyunsaturated phosphatidylcholine, PPC. You can find it under different names. 2,000 milligrams, give or take, a day would probably be beneficial of that. It has benefits. Milk thistle, very valuable, very, very important to be taking milk thistle every single day in conjunction, with PPC and vitamin E. Curcumin, astragalus, dandelion root, red clover, oil of evening primrose, echinacea, barberry, golden seal, lobella, alfalfa, yellow dock, purslane, um, ashwagandha, quince, aloe vera, buckthorn, wild yam, all are extremely beneficial in helping with the liver. You can do a liver cleanse. I'm not going to tell you how to do one, but you can look that up on the internet. Probably good to start with a liver cleanse and then add all these other things in to begin with. And then finally, if all this doesn't get rid of your Hep C, your numbers don't start coming down into undetectable range, and that's the only range that matters is undetectable, then intravenous ozone therapy. And in my opinion, listen to my podcast called Intravenous Ozone Therapy, Everything You Need to Know here on YouTube. It goes over all the different methods and why we use the ones we use, but only the direct IV method that hopefully you can get locally where you live. Only the direct IV method seems to be valuable against viruses. While the blood methods of ozone can be beneficial, they don't seem to kill the virus as well as direct IV, which is proven because I'm published on Ebola, I'm published on COVID. So we know that it can kill viruses, and we've seen it kill viruses clinically for the 34 years and over 420 plus thousand treatments that I've done over these 34 plus years. So we know that it will work against all those, against any virus. So very important that you start doing intravenous direct IV ozone therapy. And yes, you can do the blood methods in addition, but not instead of. Okay, the blood methods clean out the blood faster of all these other things, because when ozone enters your blood, it's not a guided missile. Can't whisper in its ear, hey, go after Hep B or Hep C. Leave every other virus, fungus, yeast, mold, bacteria, parasite, toxin, and harmful free radical and toxic metal alone. It's got to get rid of all those things. So when you do the blood methods of ozone, like hyperbaric high dose ozone 10 pass that we offer, you can get rid of things faster that way, and then have more of the direct IV just go after the viruses that you want to do. And of course, you can add intravenous glutathione into the mix to make it an even more powerful, call it a Robin's glute sandwich. Get half your ozone, then the glute, then the other half of your ozone. Unfortunately, this is a marathon. It is not a 50-yard dash to get rid of these viruses. It is worth every time and minute, every minute of your time and effort to come in, and every penny that you spend on getting rid of it. Otherwise, it'll take your life. I don't say that to be misread or misunderstood. It will take your life. So do what you got to do. If you have questions about this, you're welcome to call my Manhattan office at 212-581-0101. That's 212-581-0101. And the office will be happy to get you in touch with me, and I'll be happy to answer your questions. On the other hand, you can email me at OzoneDoctor, OzoneDoctor, at yahoo.com. And make sure you put your phone number in, because sometimes if it's too much to type or dictate, I will call you up and speak with you personally to answer your questions. Also, just as a reminder, Doctor's Biome is DoctorsBiome.com. And I'll let you use my patient coupon code to get 10% off the retail price. It's Howard35. Howard35. So when you go there and you're looking to check out, use Howard35. You'll get 10% off. Of course, not a cheap product, but it works. And you want to get an extra 10% off, you can always go on auto ship. You can always cancel anytime. They give you free shipping, 100% money back guarantee. But it's essential to maintain health and fix hepatitis B and C. Everybody, Hopefully you're not watching this show because you don't have it, but if you do, God bless you. I wish you the best of luck, and I'd be certainly happy to help you in any way I can. Everybody stay safe, stay healthy, stay well. Bye-bye now.